Hi, are you Shasta?
Hi, yes.
Hi, nice to meet you. My name is Elizabeth. I'm a pharmacy student. I'm here to go over your prescription Levemir today. Do you,
Okay.
do you have a couple of minutes for me to talk to you?
Yes.
Sounds good. So, what did your doctor tell you this medication is for?
I think it's for diabetes.
You're correct. So, this medication is a long-acting insulin to help you treat your diabetes. How did your prescriber tell you to take this medication?
I don't know. I'm not really sure.
Okay, which is fair. So I'm glad that you're here and really invest in your health, which makes the world difference. So have you ever used insulin before?
No.
What
No,
about,
I don't think so.
and you haven't, have you ever used a pen device before?
No.
Okay, so we can go over that today. And your prescriber wants you to inject 10 unit into your skin once a day at bedtime, little prescription. And he gave you a prescription for 3 pens with 3 refills.
Okay.
Okay. There are a lot of small steps involved in using this medication correctly. And just to ensure that I tell you all the steps correctly and accurately, I want you to hold on your questions until the end, if that's okay with you.
Okay, that sounds good.
Sounds good. So we're going to divide it into 3 big chunks. So first is preparation step. Second is how to find a correct injection site and injection technique. And the last step would be how to safely dispose used pen needle and store your medications. So first, we're going to start with how to prepare the injection. So first, I want you to wash your hands with soap and water. And this is the device that you will get once you pick the medication up at the pharmacy. So first, I want you to check the label and ensure that it is the correct insulin. Okay?
Okay.
I want you to remove the pen cap and visually confirm that your insulin is indeed clear and colorless.
Okay.
Yeah. Once you have done that, I need you to attach the pen needle that comes with the pen onto the pen device. You can simply do this by removing this protective seal, push it straight up, twist it, remove the outer cap and save it. This is really important for you to save it. So at the later step, you can remove back the needle safely. Okay.
Okay.
You can remove this inner cap and throw this one away.
Okay.
Okay. This is really important now that your pen needle is exposed. So please be careful and do not poke yourself with it.
Okay.
Okay. It is really important for you to prime your pen before every use. And when I say priming, by priming, I mean dial the dose up to 2, as you can see, and then hold the pen up straight, and then press the button with your thumb and visually see if the insulin is coming out at the end of the needle. You see there's the insulin flowing out?
Yeah.
Yeah, so this means that your pen is primed and ready to use. And it is really important for you to do this step before each injections to ensure the correct dose coming in.
Okay.
Okay. So now that we prime it, next step would be dialing up to your correct dose. So your provider wants you to use 10 unit. So I just simply twist the bottom and bring it up to the 10 unit. Okay. So there are preferred injection site for insulin use. That is your abdomen. It has the most subcutaneous tissue, so it is by far our preferred site of injection. However, you can consider upper thigh or back of your upper arm. Can be alternate injection site as well.
Okay.
So I'm going to pretend that this is our belly. So when you have a belly, it is really important to at least stay 2 inches away from your belly button and either clockwise or counterclockwise, you must rotate your injection at each dose. This is to avoid potential skin reactions that are associated with frequent insulin injections.
Okay.
Okay, so once you pick up an injection site that is above the belly button at least by 2 inches, I want you to push it straight in at a 90-degree angle. Push the injection button with your thumb, slow all the way down, and then slowly count to 5 or 10. So 1, 2, you get the idea.
Mm-hmm.
Then I need you to withdraw the needle, release the inject button,
Okay.
and that would conclude your injections. So once you're completing with the injection step, I need you to use the outer cap that you saved from the prior step, push it back on, twist it off to safely remove the pen needle away from the device.
Okay.
Now you can safely dispose this used pen needle, into puncture resistant container. So in Colorado, we are actually can throw this away in completely enclosed container with lid. So I often recommend my patient to use coffee ground can and just put the used pen needle in here. And once it fills up, I need you to duct tape around the lid to ensure the tight closeness, and you can throw the whole thing into the garbage safely.
Okay.
Okay. All right, so once you throw away the pen needle correctly, then I need you to put the pen cap back into the pen. And you can store this in a safe place away from your pet or any little children's. So next and last step is the storage. So pen that you're currently using can be stored in room temperature, and it is good for up to 42 days at the room temperature.
Okay.
However, the rest of the pen that is not in use should be stored in the refrigerator, and they are good for they're good until the expiration date on the box. Okay.
Okay.
What did your doctor tell you to expect?
I don't remember.
Okay, so you should notice your blood sugar number first thing in the morning before you eat any food should be lower within first week of using this medication.
Okay.
Most common side effect associated with using insulin is low blood sugar and weight gain, and potential symptoms and signs of low blood sugar include shakiness, dizzy, and blurry visions. And most common causes of this low blood sugars are due to delayed or skipped meals, or if your insulin dose is too high. So when you feel these symptoms, it is really important for you to check your blood sugars and see where your blood sugar stands. If it's below 70, I want you to take 15 grams of sugar. This means either half a cup of fruit juice or 6 lifesavers. Then recheck your blood sugar 15 minutes after that. If it's still below 70, I want you to repeat this step until your blood sugar is above 70. Okay? I know we went through a lot. What questions do you have for me at this moment?
Is this gonna hurt? Does the injection hurt?
It really differs by patient. However, the needles are really short, as you see. So you shouldn't feel a big pain like you get from sometimes a flu shot, because
Okay.
they're a lot longer needle that actually goes through your muscle. And this is just supposed to stay in your fat area. So it shouldn't hurt
Okay.
as much.
Yeah, that's all I was worried about.
Okay, which is fair. Um, but is there any concern that I can address with you right now?
No, that sounds good.
Okay, yeah, and just to ensure that I explain everything correctly to you, where would you store your pen that is currently in use?
The one that I opened that I'm gonna keep using, I'll keep at room temperature away from the light or any children, and like maybe probably on my kitchen counter or by the in the drawer by my fridge.
Okay, that sounds fair. So anywhere that are high and dry would be recommended space to store it. And how long is the pen that are in use are good for?
Did you say like a month?
I say 42 days. So it's a little bit over months. So
Okay.
just, yeah, it's kind of hard number to memorize. So if you have any question, we can always come back, and you can always come back and call us and we can address it.
Okay.
And it is really important for you to contact your provider if you have any problem with frequent low sugars, or if your blood sugar levels goes above 400. And you can obviously also contact me or your prescriber if any adverse effect that we went over becomes too bothersome, or if you have any questions on how to use this pen device.
Okay, thank you, Dr. Elizabeth.
Oh, thank you. I'm a student for now.